Healthwatch Cambridgeshire and Healthwatch Peterborough, you are great partners to work with. You really are one of the best across the country in terms of how you respond. So, and the reason why that really matters is that you listen to the views of people in Cambridgeshire and Peterborough. You make sure that we hear them, and then we take them up at a national level to try and get some national change that improves the lot for people right across the country. And you're exemplary in doing that, in making sure that those views of your local people make a difference to everybody across the country. And so a big thank you for the work that you've shared with us around GP appointments and dentistry, hospital discharge, and also the innovation work that you did. We think integration of health services and health and social care is a good thing. How do we know that it's improved things for people? And you led on some of that innovation. So genuinely a big thank you from me, Healthwatch England, for your continued support of our work. It really makes a big difference. So we all know that in January 2020, few of us could have imagined the calamity that was about to hit our nation. The pandemic has touched every area of our life. And although we can see that the crisis is beginning to pass, we can't really comprehend the total toll that it will have taken on health, prosperity, well-being for some time to come. So this isn't an issue that's going to go away for us anytime soon. And I think we'll be looking back for years learning of its impact. But what I can say confidently is that I'm really proud of the role that Healthwatch played in the fight against COVID-19. So thanks to the years of consolidated effort and the strong partnerships that we've built up in every community, Healthwatch England and Healthwatch throughout the country were able to respond to the COVID-19 that forced us into lockdown. And there are a few examples of that. Staff across the country were on hand to help people who were confused by the guidance. And if you remember, this time last year, there was guidance coming out every day. Sometimes it would be contradictory to the one that came out the day before, perhaps on shielding, on rules of meeting, all those sorts of things about how to access treatment. And so we made sure that we got accessible information out to people continuously so that they had a trusted source to go to for that information. And during the pandemic, over 450,000 people accessed that information online, and tens of thousands of people spoke to Healthwatch locally to really help us understand the impact that COVID was having on their lives. What we did was that we moved to doing very rapid feedback. So we'd get that information in from the public, and we would very rapidly feed that into NHS England or the Department of Health and Social Care so that they could make amendments to the guidance that they were giving out so that it would be more suitable to the audience that it was meant for. There have been some really clear messages that have emerged from the pandemic. The data told us very clearly that if you lived in a deprived area, you were twice as likely to die from COVID. The pandemic shone a light on long-standing health inequalities and strengthened the conviction that society must address the worst health outcomes. Some people had to face real difficulties just because of where they lived, their income, or their race. So when it comes to access to and experience of health services, more deprived areas tend to have fewer GPs per head, lower rates of admission to elective care than less deprived areas, despite having higher disease burden. The government patient surveys also indicate that those from some backgrounds, such as ethnic minorities, are less likely to report satisfaction with NHS care. So tackling unfair health differences will need those in power to really listen, to hear what the experience are of those facing inequalities and understand the steps that could be used to improve people's lives. We then need them to act on what they have learned. And one of the pieces of work that Healthwatch England will be doing is really exploring what are the barriers to people being heard and how do we go about dismantling them so that we can help colleagues within NHS and social care to learn from the experiences of Healthwatch, because we are much closer to communities in many ways.